women in our clinics who have said that they have a progesterone sensitivity or a reaction to progesterone therapy. And these symptoms are often things like anxiety, irritability, aggression, restlessness, panic attacks, low mood, poor concentration, forgetfulness. I mean, the list kind of goes on and on. You can see them there. So the way that a woman with progesterone sensitivity can approach this is changing the dose with speaking to her doctor. That it can be that, like Claire was saying, it can be the pessary, or it can be the number of days, or reducing the dose, or maybe going on cyclical progesterone where you're just doing it for half of the month. It can also be what Claire was mentioning earlier, that this soybean lecithin, it can be an intolerance or an allergy. And there's often this allergy crossover with soy and peanuts. So if you've got someone who's got a nut allergy, then it could be that. It can also suggest that it could be digestive. And so one of the great things that we can do as coaches is really support the digestive system to be able to absorb progesterone. If you have someone with a progesterone sensitivity, one of the other recommendations that you can do is recommend a bioidentical functional doctor who can actually prescribe a progesterone that bypasses the digestive system. So there are alternatives, and it's being mindful that if you have a woman who goes, I'm progesterone sensitive, I can't tolerate progesterone, that's not always the case. It's indicating something else, and we've just got to find a workaround.
And there are some women who really genuinely do have a progesterone intolerance, and there is a lot in her health history usually that suggests that. So there will have always been really horrendous problems around periods, oftentimes, not always, maybe some infertility. There's just symptoms where she'll go, it's always been a problem. It doesn't come out of the blue. If it's like, oh no, I've never had a problem at all, and now I'm taking my Utrogestin, it's like, okay, there's something else going on here. And what Laura said, and again, we can't make recommendations. All we can do is ask the client to do research and then go and have a conversation with their doctor. But Utrogestin is prescribed in a number of different ways. And again, seems to be a bit of a postcode lottery as to why. You're either prescribed 2 tablets of 200 milligrams for 2 weeks of the month, so days 14 to 28, or you are prescribed 1 for the whole month. That tends to be for women who are a bit more postmenopausal, although I've seen doctors trying to mimic a cycle, which always just seems really bonkers when women haven't had a bleed for 12 months and they have no idea what their day 14 would be. Sometimes as well, and I've never really understood this, a doctor might recommend that the woman does or every day apart from 3 days. The way that I talk about it with my clients is, if you're on the 2 weeks on, 2 weeks off, how do you feel in the 2 weeks off? The idea is that, as if it was mimicking our natural cycle, you're making the majority, or you're being given the majority of your progesterone at this point in the month to get you through the other weeks. But as we're going to talk about sort of how we make progesterone, if we're not making any background progesterone, that might not work. And it might be better that the woman has a whole month's worth, so they have the one every day, if that makes sense. So again, they might be on the Utrogestin and going, I feel awful, I feel awful. There is so many things to explore. Is it their digestion? Are there other things? They're on too much estrogen. Are they not taking that progesterone in the right way? So should it not be cyclical? Should it be every day? Like, again, getting them to unpicking what's going on and having the conversation with them, and then empowering them to go back to their GP and say, I want to try this every day. I want to, do this. I want to try it this way instead.